So these are the objectives for tonight. You'll identify the new disposition tables on the items you see there, identifying new pharmacy pages, identifying expansion of medications allowed to Khaki for these conditions, identifying updates to Plaquenil status summary, identifying the changes to vaccines page, and identifying changes to clarify processing ADHD standard track and the anxiety, depression, and related conditions. So I am going to, I'm sorry, I did miss something. All questions need to be put into the Q&A. If you put your cursor down towards the bottom of your page, you'll see the Q&A option. Do not put questions relating to the content in the chat. If you have a question for the chat, the questions that would go in the chat would be very administrative, how to do something like that. But for any content questions, please put them in Q&A, and either our speaker or our other experts on the call will answer those. And just a moment. Dr. Northrup, I made you a co-host, so you can unmute yourself. Everyone else is being kept muted and off camera.
Awesome. Thank you, Deanne. I just wanted to welcome everyone. It's always a delight, and we've got lots of new information to let you all know. So I'm going to get out of the way and let my experts proceed. So Deanne, back to you.
Thank you very much. And I'm going to send it to Dr. Mathers, who's got the first slide.
All right. Good evening, everyone. For those of you who haven't met me, my name is Chuck Mathers. I'm a physician in the Aeromedical Policy and Standards branch. I work with Dr. Judy Frazier, and one of the docs that helps to update these policies. The first one we're going to start off with is low testosterone hypogonadism. This is one that has been requested for a long time. This is a very, very common condition that I'm sure you see all the time. And we finally put out some policy that hopefully will help you to manage this in your AME practices. So we're going to go right into the disposition table first. This is the disposition table, how it is showing up in the AME guide. Row A is going to be those pilots treated with topical testosterone only. And so this is going to be a worn condition. So if you can determine it's under control, current medications are acceptable, no symptoms that would interfere with flight or safety-related duties, you can issue. And this is going to be a condition, like I said, that we will just warn for. Row B is going to be a Khaki. So we've made this hopefully convenient for you all with a Khaki. And for those pilots that are treated with any of the following medications, so this is going to include oral or injectable testosterone, Testopel, which is the FDA-approved pellet, anastrozole, HCG, as well as clomiphene citrate. So if they're treated with any one of those medications or a combination of those medications, you can use the Khaki worksheet. Requires a current detailed clinical progress note from the treating physician and a complete blood count CBC lab. And if the pilot meets all the Khaki worksheet criteria and is otherwise qualified, you can issue. We're going to go over that in more detail in just a little bit. Row C is going to be for everybody else. This is going to primarily be folks that are treated with like bioidentical hormones or some of the other various concoctions that are out there for low T. As many of you all know, there's unfortunately not a whole lot of just pure hypogonadism. A lot of this is used kind of in low T centers and other places. And so there's a lot of different formulations out there for the treatment of hypogonadism. And so we chose the ones that we felt had the best, safety profile and of course the ones that are FDA approved. And so for the ones that are more in the realm of like bioidentical hormones, we're going to require you to defer those cases. However, we have created an AASI process for this that hopefully will help to streamline it. So for everybody else, or if they are treated with phlebotomy, so if they require phlebotomy to maintain their hematocrits at a safe level, we're going to require those cases to be deferred as well. As you can see there, we've created a low T hypogonadism status summary. I will show you that in a minute. So they can submit that or a current detailed clinical progress note. We prefer, in this case, for it to come from a urologist or endocrinologist, but we will accept a treating physician if one of those are not available. It has to include the portions you see there in the DCPN. It has to also specifically include what medications are being used, if there's any evidence of cardiovascular disease, thromboembolic events, or prostate cancer. And then labs, the CBC performed no more than 90 days before the AME exam. Go ahead to the next slide. Okay, so we're going to focus in on row B here. This is the Khaki. Again, treated with one or more of the following: oral or injectable testosterone, Testapel, anastrozole, human chorionic gonadotropin, or HCG, or clomiphene citrate. And you would use the Khaki worksheet for that. Next slide. Okay, this is the Khaki worksheet. We're going to go through this line by line. So the key take-home points here are that the big aeromedical risk with this condition is going to be the erythrocytosis or the polycythemia that can happen with testosterone, which can lead to hypercoagulable events and things of that nature. So what you'll see here is that the big takeaway is we want that hematocrit to be 54% or less. This is based upon the Endocrine Society practice guidelines, which recommends a hematocrit of 54% or less. And so that's what we felt was most appropriate for Khaki. So the Khaki worksheet, you can see here, it says the condition is stable, current regimen, no changes recommended, and no side effects which would interfere with flight duties. We're going to give you all some leeway to kind of determine what that is. As you can see here, mild skin irritation and acne are acceptable. If that's all they have, that's perfectly fine. So for Khaki, we're not going to allow treatment with phlebotomy. We want things to be relatively stable. And then the third line, you can see any history of cardiovascular disease, thromboembolic events, or prostate cancer. We put a note in there that hypertension is acceptable if it meets standards, and there's a separate Khaki for that. But other more serious, complications, cardiovascular disease, heart attack, stroke, and things that will not qualify for Khaki. You can see here the complete blood count, CBC, within the last 90 days, hematocrit 54% or less. The medications are all listed there. Again, anastrozole, HCG, Testapel, testosterone, oral or injectable, and clomiphene citrate. HCG requires a 7-day initial ground trial, and clomiphene citrate requires a 14-day initial ground trial. Clomiphene citrate can have some visual side effects. They're not super common, but they can happen. And so we have to, we put a note in there for you to confirm that no visual side effects are present. There is a note you can see to the left there, N-clomiphene, it's got an EN in front of it, N-clomiphene citrate is not allowed. So if they're on N-clomiphene citrate, we're gonna ask you to defer. Next slide. Okay, so if they fall into that row C category, if they're not on one of those acceptable medications for Khaki, we're going to ask you to use this low testosterone hypogonadism status summary. It's very similar to the Khaki worksheet. This allows for people with phlebotomy, treated with phlebotomy, to use this worksheet. So pilots are going to take this completed page or an equivalent detailed clinical progress note and a copy of their CBC to y'all, the AMEs, for review and electronic upload to the FAA file. If you are an employee examiner, we're actually going to allow this for air traffic use as well. So you can see there, as long as the items fall into the white column on the left, and so as long as they fall into that column, you'll be allowed to issue the current medications are listed there. You can check multiple of them, and we also have a write-in section, and that would be if they're on something like a bioidentical hormone or equivalent. So this is the status summary that can be used for row C cases and will also be used for air traffic controllers. Next slide. Okay, so AME actions, this is just a blow up of the status summary. So all of the items fall into the no or clear column. Individual may qualify for Khaki too. So If any single item falls into yes or the shaded column, you have to defer. And you should note what aspect caused the deferral and explain any yes answers. Again, the status summary is not required, but like with other conditions, if you do the status summary, it helps to streamline the case and will significantly decrease FAA review time. Next slide. Okay, again, if not Khaki qualified, they may be considered for an AASI. This is the AASI page that's listed in the AME guide. If they're eligible for AASI, you'll get the standard AASI letter. And when they come back, as long as they have that authorization, they bring you that low testosterone hypogonadism status summary and the results of their CBC, you'll be given authorization to issue. There's some deferral criteria for the AASI. If any new form of treatment is started, so we're going to want to see what that is. Of course, if they develop any significant cardiovascular disease, prostate cancer, or they experience a thromboembolic event, we'll want the case deferred. Hematocrit has increased from the previous level. So, again, these are folks that are on an AASI, and we advise you to kind of, use that 54% or lower versus 55% or above as a cutoff. Now, of course, if things are borderline, you can always call us and we can go over that. But mainly we're wanting to make sure that hematocrit level doesn't get too high and put the airman at risk for thromboembolic events. Development of any side effects. Again, if you remember from the Khaki worksheet, we're allowing you all some discretion here. But of course, visual side effects are going to be most concerning. And again, mild skin irritation and acne are acceptable. And of course, if there's any other disqualifying medications or therapy not previously reported, or any other reason that you deem necessary for deferral. Next slide. Okay. We're going to go over a few medication changes. I know there's a lot of questions in the chat. We're going to get to those as quickly as we can. Go ahead and go to the next slide. Okay, so we have a few changes to medications. We've got some new biologic biosimilars and non-biologics that have been added. Probably the biggest change is that we've had a lot of biologics that are allowed, but some of them have had different observation times. And a big shout out to Vicky Q, our clinical pharmacologist, who's done the work on this. And the new process for this is to try to streamline it and make it a little easier. As far as the initial observation for biologics, we're going to, across the board, have it be a 2-week no-fly ground trial to verify no side effects. The post-dose observation time is still going to vary depending on the medication, and we've got a table published in the AME guide, and I will show you that in a minute. Changing from one biologic or biosimilar to another for the same indication is just going to require a 48-hour ground trial to mitigate any side effects that may develop. And of course, 6153 is going to apply if any adverse change in condition or adverse medication side effect requiring medical attention. So we have a lot of biologics that are allowed for Khaki, which you'll see in a minute. The one that we haven't really jumped to Khaki yet for is asthma. And that's because once they get treated with biologics, that's more into the moderate severe category of asthma. And currently those are still followed under an AASI or an SI. But for a lot of other conditions, as you'll see in a minute, we have a number of biologics that are acceptable for Khaki. Next slide. Okay, this is the medication biologics biosimilars page. I'm not going to go over every one because there's a lot of them. But as you can see here, we've got a whole list of Khaki acceptable biologic medications. And then we even have some that are conditionally acceptable with an SI as long as it's a single agent. And you can see there that the post-dose observation no-fly times vary depending on the agent. But again, the initial no-fly time is going to be a 2-week no-fly across the board. Next slide. Okay, we're going to go over a few of the Khakis. We're going to show you some of how the new medications have been added on there. This is the colitis Khaki. We've had some biologic biosimilars added to this for some time. We've got some new ones added on there, which you can see on the bottom there. So we're expanding the number of biologics biosimilars that you can use for colitis. Next slide. Similarly, for the arthritis khaki, we're allowing a number of biologics biosimilars, which you can see there in the acceptable medication category. Next slide. And for psoriasis, similarly, we're allowing a number of biologics and biosimilars. Next slide. Okay, with that, I'm going to turn it over to my supervisor, Dr. Frazier. Dr. Frazier, take it away.
All right, and thank you, Dr. Mathers. So Dr. Mathers and Dr. Q have spent a couple of months building this khaki to try and make it easier for everybody. So let us know how it works. Let us know if there's things that we need to improve. When we talk about the arthritis and the psoriasis, you'll sometimes see the use of Plaquenil or hydroxychloroquine. We've had this status summary page in the AME guide for a couple of years. What has been updated is just the form has been simplified, so it doesn't have all those fill in the blank boxes. It also makes you pick, is it a baseline, is it an annual screening? Are they low risk or are they high risk? The low risk question really refers to, is this somebody who is on the meds for 5 or more years? Remember, Plaquenil is one of those drugs that the concern is maculopathy. Maculopathy can develop over time, which is why they get annual screenings. It's dose dependent. So at 5 years is where the concern becomes. High risk is anybody that falls into the red category, or anybody who has any of the items listed in B through F. So glaucoma, renal disease, etc. So this was just to kind of simplify it into row A or item A, 5 years or more. As long as the testing is fine, then you're going to be able to continue. Most of them are on a special issuance, but if they qualify for khaki and everything's in that nothing is abnormal category, then you'll go ahead and they be able to reissue on khaki. All right, next change is the vaccine. So Dr. Q has put a vaccine page. It's been in the guide for a couple of years also. One of the questions is, how long does a pilot have to wait after getting a COVID vaccine? When it came out, it was 48 hours. We've now had a lot more experience. The other thing is about 10% of people who get a COVID vaccine get a reaction. So about 24 hours is when they'll notice if they have a reaction or not. So what is being changed is, instead of making all pilots sit down for 48 hours after getting a COVID booster or a COVID series, it's now 24 hours. And then only if they have symptoms do they have to continue to sit down. So it's just a 6153. The other part to the vaccine page, Dr. Q also looked at the shingles vaccine. The shingles vaccine used to be in the row above, saying no wait time required. After she looked at it more in depth, the concern is that people with shingles vaccine actually do get that malaise feeling after getting the vaccine. And so we did move that one to a 24-hour no-fly. So those are the two changes for the vaccine page. No matter what vaccine you get, 6153 applies. If for some reason the pilot has symptoms after the injection, they need to not fly until those symptoms abate. All right, psychiatry. We just had a couple of coordination pieces with psychiatry. We hope everybody is using the anxiety, depression, and related conditions fast track or decision tool. We also hope you're using the fast track for ADHD. One of the questions that came up specifically on the ADHD fast track and the document checklist was, we just needed to clarify that we do need records from academic or occupational if there needed any accommodations. So what you see in yellow in the middle of your screen was just adding to those documents that are requested that the psychologist will review. The next piece is the coordination piece. On the anxiety, depression, and related conditions, we had a line that said if they had any other additional conditions, they couldn't use the fast track. And on the ADHD, we said if they have any other conditions, you can't use the fast track. If they qualify for both the ADHD fast track and the anxiety, depression, and related conditions fast track, that's acceptable. We don't want you to not be able to fast track someone who has both ADHD and anxiety if they meet both fast track requirements. So that's the only piece that we updated on this page. So with that, again, if you have questions on how we can improve the guide, if you have questions or comments on any of the ground rounds, this is a mailbox that we monitor. It is not for case questions, but it is for questions about the AME guide or about grand rounds. And with that, I will turn it over to Dr. King.
All right, well, thanks everyone.